Hello, my dear future nursing officers. How are you all? Today I came with some more questions which will be helpful in getting the job, that is either in the central or state government. So nowadays there is a ocean full of opportunities, that is either in the RRB, AIIMS, NORSET. In different categories we are having several vacancies. So I really encourage you to concentrate and get good results. So let us start the topic. First question. Mallory's degeneration in alcoholic liver disease is a form of option A hyaline degeneration, option B amyloid generation, option C hydropic degeneration, option D fatty degeneration. First of all, do you have any idea about this alcoholic liver disease? It can be mostly seen in chronic alcoholic patients. Like if the patient is habituated to continuous alcoholism, the liver get damaged easily. So what are the changes we will observe in that particular cases? Like the persons may enter into fatty liver, like cirrhosis of liver, and other complications also they will get. It is one of the major fatal cause. Fatals means the death will happen ultimately. So the person who is suffering with this alcoholic liver disease must be treated early, as soon as possible. He must need to get the treatment. Here in this alcoholic liver disease, what happens? Mainly in the hyaline membrane, the changes will take place. The Mallory bodies will be seen. The hyaline degeneration will be takes place. So here the answer is hyaline degeneration. In this scenario, what happens? Mainly this Mallory hyaline body seen with these main things will be seen. Here we will use the mnemonic New Indian Watch. Means in non-alcoholic fatty liver diseases, in Indian childhood cirrhosis, in case of Wilson's disease, alpha-1 AT deficiency means antitrypsin deficiency, alcoholic liver diseases, tumor of liver, that is especially in case of hepatic cellular carcinoma, chronic cholestatic conditions, hepatic or biliary cirrhosis. Cirrhosis means here if the person there will be continuous degenerative changes will take place in the liver. So here what happens, basically there may be absence of carbohydrates will be seen. So the presence of basic protein and phospholipid components will be seen continuously. So cirrhosis of liver will happen. Whereas in Wilson's disease, here it is a rare genetic disorder. This Wilson's disease is a rare genetic disorder. Here it causes the copper to accumulate in the body. Mainly in the body we can find the elements of copper. Like mostly it can be seen in liver, brain and eyes. Particularly it will be seen, the copper element will be seen in that particular areas. Next A means alpha-1 antitrypsin deficiency. Here normally this AAT protein will be produced in the liver. This AAT what it will cause? It will protect the liver and the lungs. The protective organ of lungs and the protective protein of the lungs and liver will be this alpha-1 AT. But here in this what happens? This AAT don't produce enough amount of alpha-1 AT doesn't produce, because this liver had already affected with alcoholism and also this alpha-1 AT will not be produced. So the liver will be inflamed easily. Then tumor of liver, especially in hepatocellular carcinoma, here mainly the liver main cells, it starts from the liver's main cells, that is called hepatocytes. This hepatocellular carcinoma, it starts initially from this hepatocytes and later it develop as a liver cancer. Chronic cholestatic conditions, in this any due to cholestasis, any obstruction in the choledosac or gallbladder, these conditions may lead to liver cirrhosis. and biliary cirrhosis, any obstruction in the bile duct. Because what happens, it is a rare disease, like this biliary cirrhosis, it is a rare disease. But in this what happens, if here if we'll observe, this bile duct is, if any damage or blockage happens in this bile duct, this is the normal bile duct, this is the blockaged bile duct. Here what happens, with this blockaged bile duct, this biliary cirrhosis will be happened. The normal flow of bile duct will be obstructed. Here in this scenario what happens, this is the hepatic duct which comes from the liver, and it is the cystic duct which comes from the gallbladder, and they both unite as a common bile duct. In this normal bile duct will be affected and get blocked. So due to any inflammation, ultimately it enters into biliary cirrhosis. So as we had seen now, in case of alcoholic liver disease cases, here what happens, the persons get affected easily with fatty liver, cirrhosis of liver, and alcoholic hepatitis may happen. If the person is affected with this alcoholic liver disease, what happens? There will be the sudden right side abdominal pain. Right side abdominal pain. Then fatigue and weakness. And some of the persons may have the yellowish discoloration of the eyes, jaundice will be seen in early cases. And how this fatty liver happens? Due to the accumulation of the alcohol dehydrogenase will be converted into acetaldehyde, and this acetaldehyde will be converted into acetic acid, and later it oxidizes into carbon dioxide and water. Finally, in this fatty liver what happens? There will be the accumulation of triglycerides will be seen. There will be the accumulation of triglycerides. So in this case what happens, due to this accumulation of triglycerides, the persons will be shown as a fatty liver, and final complication will be cirrhosis of liver. In most of the cases we will be seeing this cirrhosis of liver. Here what happens, the cytoplasm will be the changes in the cytoplasm will be seen. Here mainly the absence of carbohydrates like protein and phospholipid components will be absent. Phospholipids. These are all the main things which can be easily affected in this alcoholic liver disease, and hyaline membrane changes will be seen. So in alcoholic liver disease, alcoholic hepatitis, fatty liver and cirrhosis of liver. These are the main complications which will be seen in this alcoholic liver disease. Second question, mechanism behind the characteristic feature of acute inflammation. Do any one of you have any idea about this inflammation in this process? What happens? For example, if the person is get affected with some injury like blunt or penetrated injury, or any cut happens, suddenly what happens, there is a gush out of blood from that area. So After some days, what happens, after some time, what happens, there will be the little swelling, and after 2 days like that, there will be the transudate formation, like pus formation, and swelling will be there. So in this main case, in this acute inflammation, what happens, first of all, swelling will be seen due to the vasodilation, blood flow will be seen. If we going on keep applying the pressure, it will stop easily, but there will be an injury. So inside, what happens in this inflammation process, we will see. Option A, redness and pain. Option B, pancytopenia. Option C, vasodilation and increased vascular permeability. Option D, spongy bone. Mainly in this acute inflammation, due to any injury or cut, here there will be, first of all, the vasodilation will happen. The arterioles or capillaries, whatever was there, it will get dilated easily, and later the vascular permeability will be increasing continuously. So in this acute inflammation, there will be the vasodilation and increased vascular permeability. We will see here, due to some injury, due to some prick or any cut, here what happens, the bacteria on the skin surface, slowly it enters into the below the epidermal layer. Here, from the capillaries, due to the release of chemical signals like histamines, it will surround this area. Second, the inflammation process starts. Here, the phagocytes from the capillaries, it travels to this area, and here it accumulates. They migrate to this area. So here the swelling and the pus formation will be seen. So there will be the vasodilation and increased capillary permeability. Phagocytes means cell eating. And later, these phagocytes, what they will do, whatever the bacteria entered into the body, they try to consume that bacteria, and whatever the debris means the dead tissue or removable tissue, whatever the tissue which is waste, the phagocytes use it to eat that things, and phagocytosis will happen, means cell eating will happen. The phagocytes consume the bacteria and cell debris. So finally what happens, here the platelets will be come out from these capillaries and try to cover this wounded area. Wherever the wound happened, the platelets try to accumulate here and starts this make to start this wound area healthy. Here in this mainly in this acute inflammation, some of the stimuli like infections. Infections means that may be caused by bacteria, virus or parasitic toxins. Second one, trauma. Trauma due to sudden accidental injury, that may be blunt or penetrated injury. And third one, physical and chemical conditions. Physical and chemical conditions. During any sudden explosion due to the exposure to the chemical burns or any chemical agents or any thermal injury like irradiation, these are all the things which may be harmful. Fourth one, foreign bodies. Foreign bodies. Foreign bodies means any foreign substance that may be after the procedure, the person may get this sutures inflamed and infected easily, like that due to the foreign bodies. And immune reactions. Immune reactions in the sense the hypersensitivity reaction. if the person is injected with some new drug and the person may not fit with the drug, the person may develop this hypersensitivity reaction. So these are all the things which causes this inflammation to be increased gradually. So mainly in this inflammation process, cardinal signs will be seen. Cardinal signs of inflammation. First one rubor, second one calor, third one dolor, fourth one tumor, fifth one loss of function. Here what happened, mainly this cardinal signs are the mainly seen in this acute inflammation process. Rubor means that is redness. We may call it as hyperemia. Suddenly if we observe for some fiery candidates and all, this rubor indicates there is a increased blood circulation to that particular area, means hyperemia. Second one calor. Calor means that is if we try to touch that area, so then we can feel as a warmth or hot. Third one dolor. Dolor means the affected area will get pain. Then tumor. Tumor means any swelling or any pus formation or any exudation formation will be seen in this tumor. Then loss of function. Loss of function we may call it as functiolasa. This is the main 5 cardinal signs which will be seen in this acute inflammation. So in this process mainly what happened means, first the process will be start in the arterioles. From arterioles it slowly enters into capillaries. It gradually progresses to capillaries. From capillaries the amount of blood which will be accumulated over there will be the increase in that amount of blood in that particular area. There will be the increased amount of blood. So later what happens? There will be redness and heat. As we had seen here, the redness will be rubor and calor means the warmth or hot. So these are all the main things which will be seen in this acute inflammation. Next question. The pulse that can be assessed from behind the knee is known as. There are some particular points which we can feel the pulse. Like in some, if the person is having some shock or if the person is in unconscious, we need to apply CPR, and during that time we need to check for the carotid pulse. Like regarding some conditions, we need to check the particular pulses to know the particular condition of the patient. Here they asked about us what we will assess behind the knee. First one popliteal pulse, second one dorsalis pedis pulse, option C posterior tibial pulse, option D temporal pulse. Here the pulse which can be felt backside of the knee is popliteal pulse. Here the correct answer is popliteal pulse. Here we will see some of the pulse which can be felt in our body. This is the temporal pulse. Here we will feel this at side of the forehead. Then second one facial pulse. Facial pulse means it is the major blood vessel. This facial artery, it is the major blood vessel. Here it supplies blood to whole parts of the face. Then carotid artery. Carotid artery, it is taken on the side of the neck. It is taken on the side of the neck, which will be placed either side of the throat. That is the carotid artery. Then brachial artery. It is taken in the upper arm. That is just above the elbow. This brachial artery will be seen. Here most of the time for lab investigators, the blood sample collected area is mainly this brachial artery. And radial artery, it is taken on underside of the wrist. Then coming to femoral artery, it is taken at the inner groin. The inner groin where the upper hip meets the thigh. This is the area which we can feel this femoral artery. Then popliteal artery. In this question we had seen this. Behind the knee, what is the pulse we can assess that? That is the popliteal artery. Then posterior tibial artery. This posterior tibial artery, it is taken at the back of the foot. At the back of the foot, the ankle connects to the side of the leg. Here, at posterior tibial artery, we will assess the pulse. And finally, dorsalis pedis artery. This dorsalis pedis artery present at the top of the foot. About halfway down, we will assess this dorsalis pedis artery. Frequency of urination at night is called. Option A, dysuria. Option B, nocturia. Option C, oliguria. Option D, anuria. First of all, anyone of you have any idea about this? What is the normal range of urine output for 24 hours or per hour? Per hour, the normal urine output in a normal adult patient, it will be 35 to 70 ml. Here we will see the answer first. The frequency of the increased frequency of urination at night is called nocturia. During the night time, if the person goes to continuously urine, we will call it as a nocturia. Correct answer is nocturia. Here we will see some of the things. In a normal adult, the urine output per hour. If we consider per hour, the normal urine output in a normal average adult, 35 to 70 ml per hour. If we take into consideration for 24 hours. For 24 hours, if we'll see, there will be 1.5 to 2 liters approximately. So, in case of some renal failure conditions and some other diseases, the urine output will be decreased. If the person not passing urine more than 6 hours, it can be taken into consideration. So, here we will see some of the disease conditions like we will call it as dysuria. If the patient is complaining of severe pain while urinating, we will call it as dysuria, painful urination. Nocturia, we had already seen that. Nighttime passing of urine. Then oliguria. Oliguria means if the urine output is less than 400 ml, sorry, it's greater than, right? Less than 400 ml, we will call it as oliguria. And anuria. Anuria means there will be complete absence of urine. Complete absence of urine. Anuria means there will be complete absence of urine or urine output less than 100 to 50 ml. 50 to 100 ml. There is urine output less than 50 to 100 ml. We will call it as anuria. Polyuria means more than 2 liters. During diabetic cases, we will see this polyuria. There will be increased production more than 2 liters. So, in an average adult, the urine output per hour is 35 to 70 ml. For 24 hours, it will be approximately 1.5 to 2 liters. And the in the question we had seen these options like dysuria, that is painful urination, and oliguria means there will be urine output less than 400 ml, and anuria means there will be complete absence of urine, or the urine output will be 50 less than 50 or 100 ml. And whereas coming to the polyuria, there the urine output, if the urine output is more than 2 liters, and in case of diabetic cases we will see this polyuria. Next thing, smoking causes. Main options: option A chronic bronchitis, option B lung cancer, option C emphysema, option D all of the above. This smoking in India nowadays, we are seeing this due to the effect of smoking, there will be lot more causes which affects our health easily. And chronic chain smokers, active smoking, passive smoking, like completely due to this cigarette smoking and all, the main thing was the changes in the lungs will be seen. So here, due to smoking, this all will be seen, like chronic bronchitis, the person may get affected with lung cancer and emphysema also. Here the answer is all of the above. Here what happens, in the chronic bronchitis, what happens here, the bronchi, whatever the bronchi or breathing tubes were there will be inflamed. The bronchi and the breathing tubes. Here in case of this chronic bronchitis, the bronchi and the breathing tubes will get inflamed. So lung cancer. Nowadays in males it is the one of the most common cause. The deaths may happen easily with this lung cancer. Here in this lung cancer, what happens? The alveoli or air sacs. In this lung cancer, the alveoli or air sacs in the lungs, it can be damaged easily, and there will be the development of tumors. Because cell growth takes place easily here in this lung cancer. So it is one of the most leading cause of death in the worldwide. Then emphysema. Emphysema means it is one of the chronic lung disease. Here what happens? The lung disease, the alveoli or air sacs in the lungs will be affected easily. Here also the alveoli or air sacs will be getting infected easily. So smoking causes with this chronic bronchitis, smoking causes this conditions like chronic bronchitis, lung cancer and the emphysema. In case of chronic bronchitis, what happens? The bronchi and the breathing tubes will get inflamed easily. In case of lung cancer, the cell growth will be taken place easily and there will be ultimate development of tumors. And in case of emphysema, the alveoli or air sacs, whatever present in the lungs, will get infected easily. So in case of this emphysema, if we take into healthy lungs, healthy patient, the alveoli, the normal alveoli will be looking like this. But in case of this, in case of normal individual, in case of a healthy individual, the normal alveoli will be seen like this. The healthy alveoli was like this. But in case of emphysema, what happens? The air will be trapped in this alveoli. So ultimately it gets swollen. So enlarged alveoli will be seen. Here the normal alveoli, like small alveoli will be seen. But here what happens? There will be the air trapping happened in this and there will be the enlarged alveoli. So due to this narrowing here, the smooth muscle will be present. So normally the muscles will get relaxed easily. But here there will be the smooth muscles tightening will happen. So there is a narrowed airline. The bronchial tubes or breathing tubes, the narrowing of the airline happens. So there will be the increased mucus production will be seen. Whereas in lung cancer, there is a excessive growth of the cells. Liver cells will be grown excessively. So it leads to lung cancer. Whereas in bronchitis, if we take into this normal bronchial tube, here this normal bronchial tube will be reflecting like this. But in case of any inflammation, the lining of the bronchial tube will be get affected and thick mucus formation will be seen. So these are all the things which can be caused by smoking. We need to educate the patients or counsel the patients how the smoking affects our body parts and how the members will be affected easily. So how to prevent this, how to counsel the patients to recover from that case, like that we need to explain all these things. Next question, sudden fall of temperature is called. Option A, crisis. Option B, lysis. Option C, relapse. Option D, quotidian. Here they had given this answer like the sudden fall or decrease in temperature, we will call it as crisis. So any one of you have any idea about this crisis? Crisis means there is a sudden drop of temperature. There is a sudden decrease in the temperature. So the fever episodes will be ended in crisis. For example, if the person is having continuous chills, sweating, like there will be the temperature gradual changes will be seen. Option B, lysis. Lysis means there is a gradual decrease in body temperature over several days. If we consider some days, there will be the gradual decrease in the body temperature. That is lysis. Option C, relapse. Relapse means there is a return of disease or the signs and symptoms of the disease will be seen after the improvement. If the person is get affected with some disease and during that affected time, the persons will show symptoms of fever and later some days the person will get recovered, but later after some time they will show the signs and symptoms of improvement. So it is a continuous process. So that is called relapse. Then quotidian. Quotidian means it is a type of intermittent fever. For example, in case of malaria, the fever will board for every 24 hours. For every 24 hours, if we consider, for every few hours at a time, it will rise and go. So this quotidian itself reflects malaria. So in this case, the correct answer is crisis. The sudden fall of temperature means crisis. Here, there will be, the person is having continuously chills, sweating, there will be the decreased body temperature, BP also will get decreased. All these changes will ultimately leads to death. This stage results in the death. Next question. In the following, which edible oil yields highest quantity of polyunsaturated fatty acids? Option A, coconut oil. Option B, safflower oil. Option C, soybean oil. Option D, groundnut oil. Here, the correct answer is safflower oil. Daily we will hear this fatty acids, monosaturated, polysaturated, like this. First of all, what do you mean by this fatty acids? How it will be? How we can easily differentiate this is monosaturated, unsaturated, or monosaturated, polysaturated, or mixed? Like that, you will have different types of fatty acids. So now we will see the small classification. Fatty acids. Fatty acids, it is mainly classified based on the temperature. First one, monounsaturated. Second one, unsaturated. Sorry. Fatty acids. These are mainly saturated, unsaturated. Again, this saturated will be the solid things. Like if the fatty acids, if we take at 20 degrees centigrade, it will be at solid state, like the things coming from the animal source. But specifically, this coconut oil will be comes under this saturated only, coconut oil. Except this, all other things which can comes under this animal source. Then coming to the unsaturated, here it will be this unsaturated thing, it will be completely at liquid state. Liquid state in the sense at 20 degrees centigrade, it is mostly at liquid state. Most of the things which comes from the plant source. Again, it is subdivided into polyunsaturated and monounsaturated. If we take this monounsaturated, there will be three things. The monounsaturated will be olenic acid, omega 9. These are all the monounsaturated fatty acids. Whereas this polyunsaturated fatty acids, they will call it as essential fatty acids. Essential fatty acids. These are mainly linoleic, linolenic, arachidonic. These all comes under this polyunsaturated fatty acids. These essential fatty acids like safflower oil, sunflower oil, these all comes under fatty acids. Mainly these fatty acids divided into saturated and unsaturated. Saturated means the things which comes from the animal source, whereas unsaturated it is at the liquid source, like the things comes from the plant source. Here this unsaturated fatty acids again subdivided into mono and poly. Mono means the things which are at olenic acid or omega 9, these all comes under monosaturated fatty acids, whereas polyunsaturated fatty acids, mostly these essential fatty acids considered as polyunsaturated fatty acids. Like these examples are essential fatty acids like linoleic and arachidonic acids. This plays a main role in which comes under this polyunsaturated fatty acids. So, in this today's topic, we had seen some of the important topics which are continuously repeated in the government nursing officer exams. So, try to see the explanation and try to follow regularly the videos which will be helpful in studying purpose. So, if you have any doubts or if you need any further explanation or if you want to give some of the suggestions, please help me to find in comments. So, thank you so much.